Good evening, everyone, and welcome to our second session in the series, Prescribing Positivity. Tonight, we'll be prioritizing mental health. This is an opportunity where the Office of Health Ministry of the AME Zion Church invites members of varying health specialties to join us and share their expertise with our congregation and our communities. My name is Dr. Yabo Beislow. I serve as the Director of Health Ministry of the AME Zion Church, and we welcome you to this session tonight. May is Mental Health Awareness Month, and during this month, we want to not only bring light to how mental health can affect our families and our communities, but also discuss some of the positive ways we can deal with this as a community. Now, I would love to introduce our esteemed guests for this evening. We're so honored to have them both on the show this evening. And first, I would love to present to the stage Reverend Jordan Boyd. So Reverend Boyd was born in Memphis, Tennessee. He's a graduate of Fraser High School. He's married to Dr. Sandra Simmons Boyd, and together they have 2 children. Reverend Boyd came to Rockwell AME Zion Church in January of 2013 after pastoring several churches in the North Carolina area, including Mooresville, Stills Creek AME Zion Church, as well as serving as campus minister and associate vice president of student affairs at Livingston College in Salisbury. He obtained his Bachelor of Arts degree from Arkansas State University, Jonesboro AR, and his master's degree from Gordon Conwell Theological Seminary in Charlotte. He works endlessly in and outside of the church, teaching, preaching, and advocating for the underserved in our community. He's led the church in receiving the Balm in Gilead Healthy Churches Award for 2019, promoting healthy behavior change among our church and surrounding communities. Reverend Boyd serves as an ambassador for the Village Heartbeat program and works on several clergy coalitions to support affordable housing initiatives and improve access through public health. Next, we would love to bring to the screen Dr. Sonia Richardson. Welcome. Dr. Richardson is a member of Oak Grove Baptist Church in Harrisburg, North Carolina. She is an assistant professor in the School of Social Work, director of the Race and Social Equity Research Academy, and founder and director of the Mental Health Research and Practice Lab at the University of North Carolina at Charlotte. As a researcher, her agenda focuses on developing, testing novel interventions aimed at reducing suicide among Black youth. And in her lab, she really tries to identify and remove barriers to mental health treatment for racially minoritized populations. She's a respected scholar in the field of social work and has published 2 co-edited books that we'll share one of them at the end of today's session. And additionally, she's the founder and owner of Another Level Counseling and Consultation in Charlotte. For over 17 years, the agency has been very instrumental in providing counseling services to primarily Black families. She's a respected scholar in the field of social work, appointed to the Andrea Harris Social, Economic, Environmental, and Health Equity Task Force by North Carolina Governor Roy Cooper in 2020. And in her second appointed term, she is serving as director of the Wellness Outcomes Subcommittee. Additionally, she received the North Carolina National Association of Social Workers Award for the 2021 Social Worker of the Year for her leadership and advocacy efforts. So we're so honored to have both of you. Thank you both for joining. As I mentioned to the audience previously, we just have some tremendous expertise here, and we want to lean into this.
Thank you.
Thank you. So as we have our conversation this evening, to the audience, please type in your questions. We'll get to them throughout the conversation. We do want to warn you that some of the information we may hear tonight might be triggering for some. So we encourage you to seek mental health assistance if it affects you tremendously. We will be sharing resources across the screen throughout, as well as at the end of the conversation, on how you can get help and where you can get help. So with that, we're going to kick it off with Dr. Richardson. And Dr. Richardson, you know, this being Mental Health Awareness Month, kind of guide us. What is mental health and what is not?
Yeah, so thank you so much for the invitation. I'm honored to be here this evening to have this conversation, particularly with Pastor Jordan Boyd. it is Mental Health Awareness Month. And one thing that's really important to highlight when we think about mental health, I want you to think about physical health. So when you think about being physically healthy, you think about, are you fit? Are you exercising? Are you moving your body? Are you stretching your limbs? And so that's physical health, is being well. Mental health is the same thing. Mental health is your mind well? Is your brain well? Are you mentally well? So mental health is not a negative thing. So when people say we need to decrease the stigma of mental health is positive. We all want to be mentally healthy. The difference is when we think about illness, that's when there's something that's showing that there's more symptoms or something's not right, and we need to do something about it. So if something's wrong with our body and we have pain in our body, then we're going to try to figure out the source of that pain and get to that source and fix it. It's the same thing with mental illness. When you find that you're mentally not well, meaning, let's say you find yourself just ruminating and thinking about the same thought over and over and over, and you can't get rid of these thoughts, or you find yourself having a hard time sleeping at night because your mind is just racing. Those are signs that something's going on with our brains, something's going on with our minds. And we need to maybe get to the root of that so that we can then be mentally healthy. And so mental illness is not the same as mental health. And so all of us want to practice good mental health. And when there is some signs or symptoms that something is wrong, then we want to be able to address it in a variety of different ways.
I appreciate that. I appreciate that clarification. And that comparison is not all negative. Mental wellness is just having that mind well. And Pastor Boyd, what would you say to that when you think of it in terms of the church and mental health in the church setting?
Thank you. Thank you for the question. I agree wholeheartedly with Dr. Richardson, who has been a great partner of ours in helping me in particular, but also helping my colleagues here in the city to bridge the gap and to also try and tear down the walls and barriers of stigma that have existed so long in our community around just having this kind of conversation. One of the things that we have pledged to do as pastors is to talk openly about this from the pulpit. And so I will stand in my pulpit on Sunday mornings and say, I had a conversation with my therapist this week. And I did that because I felt the need to have that conversation to help me unpack some of the thoughts that Dr. Richardson was referring to, so that I could stay in a wellness place of wellness, but also not spiral out of control in my thoughts because I had so much going on. Oftentimes we, especially for men and African American men, we have the macho mentality that just handle it. You can take it. It's not too much. And if it is too much and you complain about it, then you're weak. You're not strong in some way, which is the furthest thing from the truth. In fact, strength, being able to ask for help, is indeed the strongest sign of strength. And so that's what we do. And not only do I do that, others do that, but we encourage our parishioners to reach out and begin to talk to others when they start to feel overwhelmed, not even depressed, because sometimes people are depressed, as I've learned, and not even aware that they're dealing with depression. But it's important to be able, and the scriptures talk about when we're able to confess our thoughts one with another, when we're able to talk about some things, that we're able to find healing and forgiveness in that process.
Amen. Amen. Just thank you. Thank you for that transparency and that openness, and just sharing how you approach that from the pulpit as you're dealing with that, and encouraging others to also get therapy. You mentioned one thing, you mentioned stigma in our community. And I wanted to go back to Dr. Richardson for a moment and talk about the burden that exists in our African American community when we talk about mental illness. Can you expand on that a little bit?
Yeah. So you touched on an important topic with the stigma of mental illness in our community, and I just want to touch on that very briefly, and then I'll get to the second part. So one thing I want our listeners to realize and understand is the history behind mental illness as it relates to African American Black populations, particularly here in the United States. So historically, when we go back to early diagnoses for our populations, there were some diagnoses that we were given that helped to increase the stigma that we have currently. So, for example, there was a diagnosis called hypochondriasis. Hypochondriasis was assigned to Black mothers who were grieving their children being taken away from them and being sold into slavery. And so, when as Black women, if we showed any signs of grief, or were hysterical, which is where you get hypochondriasis from, then we were thought to have mental health issues. So we were taught historically as a population to not show emotions and to not show pain. Because if we did, then we would get a diagnosis and then we might be sold or we might be killed. And so we learned to do that. Same thing with some of the other diagnoses like drapetomania was runaway slave syndrome. If we ran away, why would we leave oppression? We're supposed to stay in oppression. And so I bring all that in to say there's some historical context to why the stigma exists and why we're still dealing with the burden of mental illness today. And it goes back to some of the trauma that our ancestors had to deal with. And so I do want to acknowledge that because it's always an important topic that oftentimes gets overlooked. And so fast forward, when we think about the burden of mental illness today, what we know based on research is that approximately 1 in 5 Black people in this country are dealing with a mental illness. And out of that 1 in 5, only about 30% are getting treatment for the mental illness. So what that means is 4 out of 5 of us who are dealing with some more intensive symptoms, like Pastor Boyd talked about with depression or anxiety, we're just dealing and suffering with that on our own. And the reason we might suffer is because of the stigma, the distrust, not knowing if I go to the doctor, are they going to send me to the hospital? What's going to happen with that? And so we're dealing with that. And then I will say, and I think it's also important to acknowledge that we're also dealing with generational trauma. So we're already born with some degree of generational trauma from what our ancestors went through, which makes it even more difficult for us to cope. And then we deal with the daily things that we have to go through. We had COVID. We experienced lots of death during COVID. There's a lot that we've been through. We had the deaths of Black people during COVID, and not just during COVID, even prior to that. So there's just been a lot of trauma that we've dealt with. And we just have to acknowledge that there's some historical, some generational context to that. And then we're just dealing with the everyday life thing. So there's stigma, there's the burden of mental illness, and there's the need for us to really acknowledge and be real with the fact that we do deal with a lot on a daily basis. And we have a God. And our God does provide, our God cares for us, and our God wants us to be well. And so we need to do to maintain our wellness.
Wow. And those are just some staggering statistics that you shared. Pretty much every family, African-American family, is affected, 1 in 5. And then just those historical contexts that you enlightened for us. When we think about that, then in terms of our families, as a pediatrician, I was sharing with you before we started the show, even pre-pandemic, so 2018, 2019, I was seeing an onslaught of kids, really young kids, African-American kids in my practice who were coming with depression and anxiety, suicidal ideation. We're talking preteens and teens. So what are we seeing now? You've talked about how the pandemic has probably worsened everything. What are we seeing in our families now? Let's start with the children, then we'll move on to the young adults. And both of you can address that, please.
Pastor Boyd, would you like for me to start, or would you like to start?
Dr. Richardson, would you? And then I'll add.
Okay, so as it relates to what we're seeing in our community, we do know that when it comes to suicide, for okay, let me give you historical context again. I got to give historical context. In the 1930s was the first study that was done on by a Black researcher on suicide with the Black community. And in the 1930s, he recognized that our rates of suicide were really low. But he said that as Black people in this country lost access to their ancestral values, and became more acculturated, like conditioned to these values here, that we would see our suicide rates increase. That was in the 1930s. For the first time ever, we have now reached a point where we have the largest increase in deaths by suicide of all races and ethnicities in this country. And so we're actually experiencing a national crisis. And the Black Congressional Caucus framed it as a national crisis in 2019. One thing, we have a chart to show about suicide rates. One thing I want you to notice, if you look at this chart, this is a chart of suicide deaths. And what you see is that those rates are really high, around that 15 to 24, 25 to 34. And then you see as we get older, our rates go down. What that's showing you is that it's our kids that are dying from suicide. If I was to take this same chart and show it for white populations, their rates are lowest for their young people, and then they get higher as they age. So it's their seniors, their older white men that are dying by suicide. So as a Black population, we have a generation of kids who are dying, and it's not okay. We got to do something about it. Now, what are we finding with these deaths that are happening, and what we're finding with our kids in general? You're absolutely right. What you said about the high anxiety, the anxiety is typically one of the diagnoses that's more prone to suicide for our population. Think about that anxiety, that perfectionism, always wanting to get it right, being told we got to work 5, 10 times harder. That is killing us. That's not okay. It's not okay for our kids. And so we have to be careful with the messaging and what we're saying and how we're communicating things with our kids and with our families. And so, yeah, so the rates are there. And we're trying to, do some interventions and create some work to address these issues.
Yep, and we'll come back to that. Some of the work and research, what it's shown us, how can we intervene? But Pastor Boyd, anything you wanted to add about our young adults, our children, and we'll move on to adults as well, what we're seeing?
I think that Dr. Richardson has hit it on the head, but even in an expanded way, when you talk about the internet, when you talk about the level of exposure that our young people have today, when you talk about the ability to have a mistake that you make in private become public in a digital platform, and there's a digital record forever. When you talk about the level of violence that exists in our community, when you talk about the messaging that goes on, I was reading today where the governor of Texas pardoned the man who killed one of the Black Lives Matter protesters. That's a distinct message that is being sent. And if you're an African American and you're part of a movement, there are intentional acts that are being done by institutions and persons in power that are sending messages to us as people of color to say that we're not going to stand with you, and even if the arms of justice does side with you, we're going to overrule it. To think that those kinds of signals do not have an impression upon us, we're falsely mistaken. We're grossly mistaken. They do impact us. I was having a conversation with a young person today who is having suicidal ideations. And in that conversation, they mentioned 7 things that they're worried about as a young person. 7 things that they're worried about as a young person. And they're so overwhelmed by their thoughts that they're considering taking their life. It is for me as a pastor, and if my colleagues are listening, it is important for us to be able to have readily available resources that we can help our people access immediately so that they can get the attention that they need, and that we can walk alongside them from the spiritual perspective, but this requires specific professional help that is outside of our realm. I believe and I'm happy to partner with Dr. Richardson because she also believes in the value of spirituality in the therapeutic approach. But what has become very apparent for me is that not enough of us who are on the front lines a lot of times in seeing the trauma that exists and the level of crisis that exists in so many of our families. So many of us are not tapped into the necessary resources to help our people access help in that level. So I'm hoping that this kind of conversation and others can help, that we can challenge our leaders to do so, and even challenge our lay people to say, hey, this is something we can do. This is something we can start, even if it's just a conversation.
That's right, because we are in a crisis. We are in a crisis, and we have to go ahead and put steps into place now. And so that's why I want to kind of turn the conversation around. You mentioned already, Pastor Boyd, recognizing that in your congregation from a leadership standpoint, knowing how far you can go and to seek professional help and encourage your members to seek professional help. So, Dr. Richardson, let's look at that, from a parent perspective, per se. What should you be looking for at home, with your kids, with your young adults, that would signal to you that something more needs to be done?
Yeah, so good question. There are several signs that you'll want to look for with your kids. So pay attention to their nonverbals. So how are they looking on a daily basis? Are they keeping their head down? Are they, are you finding their shoulders are a little sunken and they're not kind of looking you in the face or in the eyes anymore? Kind of think about what are their nonverbals communicating to you? And not just their nonverbals, but also verbally. What are they saying? What are they not saying? Are they losing interest in activities that they used to be really interested in? So if your son used to play sports, used to play basketball, but now he's not wanting to play basketball anymore, that could be a sign that might be a red flag, because there is a loss of interest. There might not just be a loss of interest in hobbies and activities, but there also could be a loss of interest in eating. And so maybe they're saying, I'm not hungry, I don't want to eat. Or it could be excessive sleeping. So you're looking for any change in patterns and changes in behaviors. So you're watching behavior, you're listening to their verbals, paying attention to their nonverbals. And then, as Pastor Boyd mentioned, one thing we know with our kids, particularly Black kids, we have a study coming out, I think, within the next week or two on Black middle school adolescents. And what we found in that study is at a national level, 1 in 3 are reporting being bullied at school. And then another 20% are reporting that they're experiencing online bullying. So you have a segment of kids who aren't getting away from being bullied. They're bullied at school, they're bullied when they get home, and they're on social media. So they don't get a break from the bullying behaviors, which is a result of social media and some other factors. And so paying attention to their use of social media. What are their emotions like? How are their emotions shifting and changing? Are you finding any differences with that? And so really just pay attention to changes. Changes are your number one indicator. And then them beginning to lose interest and not engage with friends or activities or family or eating or sleeping excessively. Those are some of the signs you want to look for.
Thank you. And we encourage parents also when they start to see those signs, to let their pediatrician know. A lot of parents are tuned into a pediatric provider for their kids and their young adults. Let them know, get the necessary referrals in place. As Pastor Boyd said, if you're in the church setting, refer out as well, because again, we're in a crisis. Wanted to move more now into our adults, our women, our men. What are some of the issues that are really prominent now, and how are we starting to address those?
I'll go first. for me, as I stated earlier, being open about this from the pulpit, but then also having our men sessions where we bring in speakers and have intimate conversations about gender specific needs that can cross multiple areas of need for men, and creating a safe space for all generations to be a part. I think that is key, so that every generation can understand that while every generation was different, every generation had its own challenges, has its own set of challenges. And there were ways that were healthy and unhealthy ways of dealing with those challenges. I think it's eye-opening for our our more seasoned generation today to even hear young people talk about some of the things that they have to deal with. Because I always heard all my life from my father what he had to do by the time he was 14, how he was caring for the family, and I didn't do much. So I carried that same language over with my son. I hope he doesn't do that with his son. But it's kind of the tradition that we pass along without understanding and realizing we're transferring a level almost of guilt that we're not doing enough. You're not doing enough. And they're straight A's and B's in school and playing sports and extracurricular, and it's still not enough. And so we're not even conscious and aware of some of that stress that we bring about on ourselves, but having men to have intimate conversations one-on-one sometimes and in small groups, we have found to be very effective in helping just to talk about things that we oftentimes refuse to talk about. And the results that I am seeing and some of my colleagues are seeing is absolutely phenomenal. And I'll give you an example of one. It was actually a Saturday. I was at the church, and a grandfather brought his grandson by the church who was having a crisis. And I was in a meeting, and so I wasn't able to see him. But when I called him, he was driving around the city trying to find somewhere to go to take his son. And thankfully, through my relationship with Dr. Richardson and some others, I could immediately walk him through the steps of where to take his son. This was a grandfather who's recognizing that his grandson is in a crisis and is wanting to get him help, and came to the church because we talk about it all the time to find out where he should go. So it works to talk about it, and to talk about it from the pulpit, as Dr. Richardson had said, not from a negative perspective, but from a positive perspective. It is a sign of strength, not a sign of weakness.
Amen. Amen. Not something to hide any longer. And for generations and for years, we've been told to hide it, or felt that we should hide mental illness, I should say, and not putting it out there in the open, but realizing how it can help others. And Dr. Richardson, share with us, in your labs and your research, what's working. We've talked about where things are. Now, what's working? Dr. Reverend Boyd already talked about having those conversations, being open about it.
Yeah. So Pastor Boyd and I think it's been a couple of years ago now, we started working together and identifying some people that he was working with in the local community, perhaps in the church, who were needing to get connected to a therapist, but maybe didn't have that level of comfort yet. And so Pastor Boyd would contact me. I would then contact the individual. We would have conversations. And what we were finding is when it came to our community, it wasn't a matter so much of saying, okay, this person really needs to see a therapist. Let's just refer them and wait for them to go. That's not it. That's not the model. What we found in our work together is that once he referred the individual to my agency, we then had to take a couple of weeks, sometimes a couple of months, sometimes even a year, and develop a relationship with that person and build trust. And then once that trust was built, then they would say, oh, you know what? I think I'm ready to see a therapist. And so it took time for them to be comfortable with having the trust to see a therapist and have therapy. And so, long story short, what we've now done is we've taken that model, created a community-based model where we're now working locally. We have some funding from some state initiatives. We have a uh, federally funded Black suicide prevention intervention that we're working now with the faith community on. Because what we recognize and what I recognize as a provider, a Black provider, the last 17 years, is I can't do this without the faith community. I can't be as effective with this work unless I'm doing this hand in hand with my churches. Because guess what? When that pastor tells that individual they need to see a therapist, they are 10 times more likely to follow through, come to therapy, and participate because they're trusting who they're getting that information from. And so when we think about the healing of our communities, interventions are going to require these faith provider partnerships, which we've been very intentional about building here in our city and in our state. And they're going to require us to resist how we do business, how we normally do business. How these services were created were not necessarily created with us in mind. And so in our lab and in our interventions, we've worked with the local Black community. The Black community here in Charlotte helped us to develop a youth suicide intervention. And we're now doing an open trial. We're going to start doing a randomized clinical trial within the next 6 to 8 months with the faith community. And so we're working hand in hand with the faith community to develop interventions, to test the interventions, and to create something specifically for our community that is created by us, for us, to help heal our community. And so those are some of the things that we're doing that we're really excited about. But it's been through these efforts with the faith community that we've made progress.
Well, thank you. Thank you for sharing. Those are initiatives which will much reward because much needed. There are not enough therapists, as we know, and just forming that network, that process to get people seen. Lots of chatter in the chat box saying this is great information because we hide it for too long. We're in denial. Wanted to talk about on the individual level for a minute, Dr. Richardson. You talked about seeing a therapist. So as an individual, I'm out here on my own or with a family member. I see some signs, not sure what to do. What does it mean when you say seeing a therapist? What does that entail? Because for many people, it brings, a lot of connotations. So what does that mean?
Yeah, it's a good question because we do say see a therapist. So what does that mean? Luckily, I will say, but not luckily, a positive result from the pandemic was the availability of telehealth. And so the way this works is, let's say you want to see a therapist, not necessarily because you have mental illness, it could be that, but maybe you want to like address some mental health and like keep yourself whole and keep yourself well and just make sure your mind is good. And so let's say you want to see somebody. So you might do some research. We have some resources going across the screen. You might go to therapy for Black girls or therapy for Black men. Identify you a local therapist or someone in your state that can see you. So you want somebody in your state because they have to have a license in your state. And then you contact them for that first appointment. When you have that first appointment with them, we call them sessions. So you have a session. So when we say we're seeing a therapist, you're seeing someone for a session. Your sessions are usually about 45 minutes to an hour. And that person is like, the first session, they're going to be asking you a lot of questions, just assessing what's going on, what your needs might be, hear a little bit more about your goals. And then after they see you for that first session, you'll come up with a treatment plan or some goals. And then you'll see that person for the next couple of months, maybe next couple of weeks, however frequently you all decide. It could be once a week, could be every other week or once a month, but it's based on what you need. But that person is listening to you process your thoughts. They're listening to what you're saying. They're then helping you to understand and make connections between what you're saying. They're helping you to identify faulty thinking patterns so you can change and reframe those thoughts. And so they're working through different processes that help to retrain your brain to then practice and have and promote more positive mental health. And so the strategies do work. And then, as Pastor Boy says, we then incorporate spiritual elements. And so, for many of my clients, we're also incorporating spirituality. We might pray in a session together. I might tell my clients to get their oil and let's go do some, let's go kind of let's do some stuff in the house or open the windows and let some stuff out of the home. So we do a lot of incorporating the spirituality practices. But it's your person that it's your go-to person that you can be real with and authentic with, and they're not there to judge you, and they're there to help you to listen to, they're there to listen to your thoughts and help you to understand where you might need to retrain some of your thinking, so that you can live a more fulfilled, healthy life.
Thank you. And I'm going to piggyback on that a little bit because, a lot of times we shy away from medicine. So you talked a lot about therapy and sessions. Psychiatrists, psychologists, tell us the difference. Do I need to see both?
Yes. So good question. So you have your therapist. A therapist is usually someone who is licensed as a social worker, psychologist. It could be a counselor. So you have therapists. Then you have a psychiatrist. A psychiatrist is a physician, and they are trained to treat mental health conditions. So I often tell my clients, it's kind of like, let's say you're going through life and things are really difficult and you just find, let's say you're really depressed and you just can't get the motivation to get out of bed. And so now you've missed weeks and weeks of work, can't pay your bills. Now things are really struggling. Therapy is not necessarily it's going to help you some, but you might need a little bit more. And I tell my clients, it's like like you're going down the street and there's a road bump. There's a road bump and you're trying to get over the hump. And if I can just get over the hump, then I can keep going down the road. When it comes to your mental illness, when you find you're really struggling in life and therapy and talking is just not it, then the medications oftentimes get you over the hump. And I tell my clients, you don't often have to be on medications for life. They get you over the hump so you can keep going through with life. And so, so I liken psychiatry to that. And then, of course, your psychologist, they can do therapy, but they can also do assessments. So if you think your child is struggling with ADHD, or you think you might be dealing with something more serious like schizophrenia, or things like that, then you're going to want to see a psychologist because they can do more detailed testing to really make sure you're getting the right diagnosis, because you don't want to be diagnosed with something that's not correct. You want to make sure you got the most accurate diagnosis.
Yes.
Excellent. Excellent. Reverend Boyd, you were going to say something?
No. I was going to say ditto to all that Dr. Richardson has said. I thought that was a great question, because there are differences in the levels of expertise. And one of the things that my colleagues and I have agreed as part of the hub work that we're doing is to encourage our people to take their medicine.
That's right.
Mm-hmm.
Take your medicine. I don't like it. Go back and tell your doctor you don't like it. Tell them why you don't like it, and get some different kind of medicine, but take your medicine. No, I don't like to take medicine. I just pray about it and I just ask the Lord to help me deal with it. No. So I openly talk about the gift my father gave to me of high blood pressure.
Mm-hmm.
And the challenge I had when one of my doctors abruptly took me off one of my medicines and sent me spiraling into just uncontrollable numbers. And it took me over a year to get the right combination of meds to get me back to a normal place. And I journaled that with my congregation. I walked through that whole entire struggle with my congregation, especially for the men, because the complications of uncontrolled high blood pressure is the culprit of so many of the problems that many of our people and our community are facing. Diabetes, kidney failure, heart attacks, strokes could have all been avoided or prevented had we addressed the blood pressure issue.
That's right.
And it really goes back in full circle because of the lack of trust we have with our doctors and the stress around that, but being able to feel comfortable in believing that we can find help.
Right.
So I found that the more we talk about it, the more comfortable we become with being willing to address it and to seek treatment, to seek help.
That's right. Thank you both. There is help for whatever stage you're at, and whether it is with a therapist, a psychiatrist, or all three. Taking medications, that may all be part of it. And as you said, Dr. Richardson, helping those bumps in the road, but all may need to be there one time, and maybe just one or two at a time, but being open to all of them and getting the backing from your pastoral leadership as well. So, you both mentioned some initiatives that you're doing. I just wanted to highlight Village Health. If you could tell us a little bit about that initiative, Reverend Boyd or Dr. Richardson, and how you help in the North Carolina community.
Go ahead, Dr. Richardson.
So thank you. So there is a nonprofit organization, Village Heartbeat Inc. in Charlotte, North Carolina, which is several churches. Pastor Boyd is the chairperson of the board of directors. And with that initiative, we've been able to secure some funding from the state to create a Bridge to Better Mental Health program. The Bridge to Better Mental Health program has created mental health hubs at 7 different churches here in Charlotte. So now we have community health workers and peer support specialists who are the bridge connecting people to providers and therapists. So the model we talked about, where people necessarily aren't ready to go straight to a therapist, they need to build trust. We now have people who help to build the trust and then get those individuals connected to providers, whether it's Black providers that they prefer, psychiatrists, et cetera. And not only are we connecting them for mental health care, but we're also addressing their social determinants of health. And we're finding that the people coming in might need help with food, or maybe they need help with housing, or they're having financial related issues, and that's what's causing their stress. And so the program has been very successful in meeting the needs of residents here in the city and really addressing some of those needs. So we have that initiative that's going on. And we're now in the phase of expanding that initiative and creating youth mental health hubs. The youth mental health hubs will focus on Black youth who have experienced suicide ideation within the last 90 days. And we're going to work with those youth to help them to really be able to thrive and not want to give up on life. And so we've been testing an intervention, like I said, that the Black community developed. We've already saved a couple of lives with that intervention. And so our Black youth have been benefiting, and we're working closely with Village Heartbeat, Pastor Boyd, and the local churches to really create some initiatives for our community to heal. So really excited about that. Pastor Boyd, you want to add to that?
No, I think you summed it up. This came out of our meeting and work that we were already doing, Dr. Bisolo. The pandemic really pulled the covers back and exposed for us the need that had been exacerbated by the 2 years of isolation. And we were blessed with an opportunity to come together and work in this way. And so I think one of the most interesting things for me that I found that Dr. Richardson has shared is that while churches are hubs within various zip codes throughout the county, throughout the city, and oftentimes we'll have people say, I don't want to go to the church, but I will participate because it was vetted by the church. Mm-hmm. And so, and that's not something uncommon even for people who are members of the church. But to hear that it is still seen as an opportunity that has been vetted by the church as something that is trusted for people to participate in gives me great hope.
Excellent. and hopefully a model that we can replicate across Zion, across the nation. Um, Charlotte is blessed, North Carolina is blessed to have you, but we'll love to see this throughout. So we'll be chatting more. As we kind of come to a close, I wanted to share some resources that Dr. Richardson has graciously provided for us. You see some of them across the screen. There's an infographic that shows all of this. And so you can take a quick picture of it once we put that graphic up. And all the links are rolling across the screen. These are places where you can get mental health resources. A lot of it is through telehealth. There are some apps as well. And we encourage you to, again, take a picture of this, share it with friends, family, community members. We also wanted to share, Dr. Richardson has a book out, Experiencing Greater, an Intimate Journey with God, that she published last year. And the link for that book is also in the chat through Amazon. Again, Experiencing Greater, an Intimate Journey with God. There it is right there. Thank you. Thank you. So I encourage you, as you can see, it's wonderful to have a healthcare provider who is in tune with God, so that, you know, it's all there in one place. You're getting 2 for 1, as she says. She will pray with you as well. So hopefully there are many more like her. One of them actually is Dr. Samantha Jordan. She's a member of Short Temple AME Zion, and she wrote an article this month in the Star of Zion. So if you look in the May e-newsletter for the Star of Zion, it's Nurturing Our Emotional Health, and she's sharing again some of these great nuggets with us about protecting our mental health. We also want to please stay tuned with us. Hope you're enjoying these sessions once a month where we are talking to different specialists. On Monday, actually, we'll be talking with a nutritionist and one of our church leaders. The nutritionist is Tempest Harris, and church leader, Reverend Dr. Matura Chase Williams, will be talking about nutrition and how we can reimagine a healthier diet. As Reverend Boyd pointed out, one of the things that continues to plague us is high blood pressure and how that impacts so many aspects of our lives. And one of the ways to kind of help prevent that is through a healthier diet. So we'll be talking about that on Monday. And then lastly, look forward to General Conference for so many reasons this year. Of course, for our re-elections that will be occurring, our elections, I should say, that will be occurring in July of 2024 in Greensboro. But we're also planning a health fair. And we are going to be bringing together specialists from across the country who will be talking about women's health, breast health. We'll have blood pressure screenings, glucose screenings. We'll have mental health awareness there. We'll also have an opportunity to have exercises in the mornings before you get started on your day. But again, just putting health in the forefront. So as we close, I wanted to turn back to our panelists. First, I want to say thank you to Brother Kent, our Chief Communications Officer, for hosting us this evening. But I wanted to see if there are any parting words, first from Dr. Richardson and then ending with Pastor Boyd.
I would just say to prioritize your mental health. Prioritize just staying healthy on a daily basis. Just as much as we practice on our physical health and take care of that, really prioritize your mental health on a daily basis, and get into the Word. The Bible has, as Pastor Boyd mentioned, there's plenty of scriptures about mental wellness. And so kind of look at those and meditate on those.
Thank you. Reverend Boyd? Mm-hmm.
Yes, no, thank you. Thank you again for having us on today and giving us the opportunity to share. I would just like to say to all of my colleagues and to everyone on the call today that our health is indeed our greatest wealth. And we all know from a spiritual perspective, because we talk about it all the time, that the attack that comes from the enemy comes first to our mind. And it is this need to emphasize and focus on. I think Isaiah 26 says it best, that if you'll stay, he will keep in perfect peace whose mind is stayed on thee. So with that, peace unto all who are on the call tonight.
Amen. Amen. Thank you both so much. This has been such a wonderful, wonderful discussion with both of you. And I just so thankful that we're able, like you said in the beginning, Reverend Board, to talk about mental health and mental illness so openly. And as you can see from the audience, it's much needed. People are very thankful for this conversation tonight. And this is something that will continue. It's not just a one-time conversation. We'll continue these conversations throughout the year, not only for May, Mental Health Awareness Month. So again, I want to say thank you, and thank you to our audience. And with that, we say good night, and join us on Monday for our next session.
Good night.
Thank
Good
you.
night. Thank you, everyone.